I did only get in yesterday at about 1 o'clock, and I'm staying near here, but I did make it over to downtown, at least for a short while. So I've seen a little bit of downtown and the bike lanes downtown. I know there's, I'm sure a lot of you could share with me more of the history, and I'm sure some of the controversies and issues that have gone on with those. But again, I'm happy to be here. What I'm going to focus on today, and I know a few of you may see me again tomorrow, it will be a different talk, and there will only be a few slides that look similar. So, all right, thank you. I'm pretty sure we'll have time at the end for some questions, and I look forward to a discussion with you. So, building an inclusive cycling city. So I'm starting from the premise, I'm assuming everyone in the room agrees that cycling is healthy, it can improve health, it's a good thing that we want to do for all sorts of reasons. I'm not going to go over that literature. So I'm starting with the premise that we want to increase cycling, and particularly, I'm a planner, I focus on cycling for transportation or utilitarian purposes. And if we want to increase cycling significantly, we're going to have to increase or diversify who is cycling. And the photos I have here are sort of what you see in most North American cities. It's certainly starting to change, but this is typically who you see cycling. And we need to start changing that to see some different types of faces cycling in our cities. And how do we do that? Because when we look at North American cities, rates of cycling definitely vary a lot by demographic characteristics. And I say at least in some places. Now, North America, for the most part, with probably some small city exceptions. In particular, one thing I'll focus on a bit is the gender gap in cycling that I think most of us in this room have probably heard about. These are numbers from 6 different countries, US, UK, and Canada on the left there, where at most 30% of the trips, bicycling trips, are made by women, compared to about half or more in Germany, Denmark, and the Netherlands, which are countries that have much higher rates of cycling overall and are generally viewed as very cycling friendly countries. We also have an age gap in the US, UK, and I'll show you some Canadian data on the next slide. So this is that same measure, the percent of trips made by cycling, and you can see in the US it drops off significantly once people become adults, or if you driving age in particular, 16 in most places in the US, drops off significantly, and while and then continues to decline as we get older as adults. But you can see those rates in, I want to make sure I don't, there we go. Denmark and the UK, or Netherlands, Denmark, and Germany, rates for older adults are the same as for younger adults. People do not stop cycling as they're getting older. These data are for Canada. It's a little different measure, though. This is the percent of people who cycled in the past 12 months. These are data from 2013-14 from Stats Canada. So it shows here by age, and again, you see that big drop-off as we all get older, and the gender gap persists, and particularly in that oldest age group of 50 or older. Also, in terms of Canadian data, looking at income, and here we see, again, that gender gap persists amongst all income groups. And here we see higher income groups cycling more. I have not dug into Canadian data, but I can tell you in the US, that's because higher income adults in the US are cycling for recreation. They're mountain biking, they're road biking, they've got 6 different bikes, they go on bike vacations and all that, the Lycra, etc. Type of cyclists, and that is definitely tied to income, and that's what most of the cycling in the US is. This slide is some data from the US, and I have to say I tried to get some Canadian data, but I'm a researcher in the US, so all of my original research has been in the US, and so I'm going to use my own research, but I think the lessons are easily applicable here as well. And so this was a national survey I conducted in cooperation with our National Association of Realtors, and it was done in the 50 largest metro areas in the US, which gets relative, definitely Edmonton and Calgary fall in size-wise, definitely in that range. And we can see some differences, and the thing I want to highlight here is I have made a distinction here. The red are people who biked for transportation. So they commuted, they went to the grocery store, something like that. And the blue are people who only biked for exercise, strictly recreational cycling. And this is where you start to see some particular differences. So for example, the gender gap. It's a much bigger gap when we look at transportation cycling than when we're looking at recreation cycling. Some other interesting things, you may not be able to see this, but this top row here is no kids in the household, and this is kids in the household. And people with kids in the household actually are far more likely to bike for recreation, and I assume they're biking with their kids, which is a nice thing to see. We actually don't see a difference in rates of cycling for transportation. So that idea that perhaps having kids prevents you from cycling for transportation, actually don't see a whole lot of evidence of that. And then again, you see some income differences in terms of cycling for recreation. Now, one thing I realize I have to include in every talk, I almost didn't put it in here, but I thought I better put it in here. How many of you have heard of the 4 types of cyclists? Yeah, I figure about half of you may have heard about it, and I was sort of thought, oh, I better address it, or it might come up in Q&A. So Roger Geller, who was and still is the bike coordinator for the city of Portland, Oregon, came up with this typology of 4 types of cyclists. And it's actually, that's the shorthand. It's really 4 types of adults with respect to how they cycle, because not all of these people actually cycle. And these were his estimates of what share of the population is in each of these categories. The smallest being the strong and fearless. Those are folks that will ride without any bike-specific infrastructure. Then you have the enthused and confident. As you might expect, they feel confident. They like having a striped bike lane, for example. That makes them feel better, but they don't necessarily need a whole lot of protected infrastructure. Then you have this largest group, the interested but concerned. These are folks who would like to bicycle more, but they don't feel safe in most places, in most cities where we don't provide them much comfortable infrastructure. And then you have the no way, no how, which are folks who either because they're just not interested or they're physically unable or other reasons, they're just no way, no how are they going to cycle. These were Roger Geller's estimates of what share of the population, at least in Portland, fell into each of those categories. We did a couple surveys, one in Portland and one, again, that national survey in the US. And this has been replicated in a few other places. I don't know if anyone, I think maybe there's been some surveys in Canada that have done something similar. So nationwide in the US, we found very similar distribution. A little over half were interested but concerned, and a slightly greater share in the no way, no how. The idea is, how do we build infrastructure and offer programs that's going to get more of these interested but concerned people, adults, cycling? Okay, so what I'm going to focus on now is sort of what explains some of these demographic differences and what can we do about it. I'm going to start with the socio-ecological model, which is used a lot in health research and practice. And pretty simple concept and idea, but it makes a lot of sense, very intuitive, that there's several different factors and sort of layers of factors that are influencing behavior and therefore health outcomes. Starting with the individual, and then getting the next step is sort of the more social, cultural realm, and then we get into the physical environment, and then the policy context. And I'm going to step through each of these. And I'm going to pause a moment and ask if someone can bring me my coffee, because my throat's getting dry, and thank you. All right. So starting out with at the individual level, one thing we always have to remember is that there are some people who, at least who physically cannot ride a bicycle. Now there's a range there. So again, these are data from our 50 largest metro areas. And as you might expect, as people get older, and here I'm displaying it by the generation, so millennial. When we did the survey, which was about 4 years ago, we didn't add the new whatever Gen Z or whatever the younger than millennial generation is. But we have millennials, Gen X, baby boomers, and the silent or greatest generation. And you can see that, 29% of those oldest adults stated that they were physically unable to ride a bicycle. We also see gender differences with more women stating that. We also see income differences. Now I looked because gender and income would also be correlated with age. And so I did look at the numbers, and even when you control for age, you still see some gender differences and income differences. So they persist even when you control for age. So one of the solutions or ways to address this is thinking about the actual bicycle itself. Either electric assist bikes, tricycles, other types of bikes that are easier to ride for people with some physical limitations. We have done a couple surveys in the US of e-bike owners. The last one was done in 2017. We surveyed over 1,600 e-bike owners, and 28% of them were owned by people age 55 to 64, and another 19% of those were owned by people 65 and older. They're definitely a solution for people, as all of us at any age could encounter some mobility difficulties. Some of our earlier research, we interviewed e-bike owners. For example, we interviewed a woman, more middle-aged woman, who had been an avid cyclist, was in a crash, was injured, and then also had some problems with seizures. She could not physically ride her regular bike anymore, even though she really wanted to, but the electric assist made all the difference. It helped her balance, it helped her speed, and she felt confident enough to continue to ride that electric assist bike. You can see some quotes here from people from our most recent survey of older adults in particular liking the e-bikes, and we also see some gender preferences. So for women, it can often be something that helps them keep up in traffic, make them feel more confident on an electric assist bike. There's a program in Portland, Oregon a while ago that had a loaner program of electric tricycles, electric assist tricycles for older adults, to have them try them out and then perhaps buy one or invest in one. It was successful for a couple of years, but was not continued. There's a handful of programs here and there that are doing sort of e-bike lending programs to allow people to test them out that perhaps get them biking more. Also at the individual level, attitudes are really important. More and more research is showing, particularly for bicycling, people's attitudes. Do they like bicycling? Does it make them happy, etc.? Makes a huge difference. Not so for other transportation modes, for example, walking or transit, etc. But for biking, for some reason, your attitude makes a big difference. And you can see here, I've showed just the gender differences. So women were less likely to agree with the statement, "I like riding a bike." We see no gender differences with respect to liking walking, for example. If we look at some of the other demographic groups, we definitely see, again, that liking bicycling drops off as adults are getting older. The income differences are not as significant either. So I have a little bit of data from teens and tweens. We did a longitudinal study in Portland, Oregon, where we followed 300 families over a couple years. And these data are from the boys and girls in that study who were aged 5 to 10 and then 11 to 16. And over 2 years, we asked them, we had them fill out surveys, asked them the same question, I like riding a bike, and it was an agree to disagree scale. What this is showing is that for the 5 to 10-year-old kids here, and these are the same exact kids 2 years later, boys and girls equally liked riding a bike, and it dropped off a tiny bit, but not statistically significant drop. So they like riding, and they continue to like riding 2 years later. Then there are 11 to 16-year-olds in our study. We start to see a little bit of a gender gap here, and then those exact same kids 2 years later, the boys went up a little bit in their attitudes and the girls went down, and now we have a difference. Now, these numbers are still pretty high. I mean, this is Portland, Oregon. We're sort of known for bicycling, and it's a supportive environment. And so in a different city, the absolute numbers might be different. But this gender gap appears to be starting fairly young. It's starting, at least from these data, in that sort of 11 to 16-year-old range. So what are some solutions? How do you change people's attitudes? There's a whole science and non-science to that, but I'm just going to throw out a few more active approaches, including things like skills training or mentoring or buddy programs, group rides. This is a quote from some research that was actually done in Australia, but gives you an idea. It was a skills program that was targeted to older adults. And a quote that I particularly like from that study of just the feeling of bicycling and how positive that is. And that's the kind of thing that can change people's attitudes. There is a lot of research that shows that it's reinforcing. The more you bike, the more you like it, and your attitudes improve. Another program are open streets events, ciclovías, close down the streets for a Sunday or a different day for several hours. We have them in Portland at least 5 times a year. The first one comes up next weekend, I believe. The Portland model of doing these, the routes are usually in neighborhoods. It's not, we don't focus on the downtown. We go out into the neighborhoods and try to highlight bike infrastructure that is in people's neighborhoods and close down those streets and introduce them to that. And you know, it's a several mile multi-hour party that people just love, and it makes us all happy. All right, and another thing at the individual level to keep in mind is a lot of people actually don't own a bicycle. In our US sample, it was about 47% of all the adults did not own a bicycle. And in particular, you definitely have some income differences. Lower income are far less likely to own a bicycle. So one solution to that is bike share, which more and more cities, both in Canada and the US and elsewhere, are doing. These photos are all showing sort of station-based bike share, which is where we've done our research from Portland State, but more and more we're seeing dockless bike share systems. So this is one avenue to increasing access to bicycles. Other programs, loan a bike or earn a bike programs, are done in a lot of cities, particularly targeting lower income households and kids. Okay, so that socio-ecological model, going up one level and looking at social cultural issues. This is one area I'm just going to say there's less research on this, and ideas of social stigma and things like that. I have less data about that, and it's one of those things that I also think varies a lot city to city. There are certainly some places I know in the US, and I imagine in Canada as well, where the attitude is if you're riding a bike, it must mean that you either are too poor to own a car, or you've been convicted of driving or operating under the influence, I think is the proper term. But it really obviously does vary. But some of the things that I found interesting in data that I've collected, and again, this is in Portland, which is a pretty bike-friendly city. When we surveyed some of these barriers that you might, which is sort of the social, do people, you know, my family or my friends, would they support me if I wanted to bicycle more, that idea of social support? We actually did not find that is sort of a reason for the gender gap. We actually found that women were more likely to say that people would be supportive of them bicycling more, and they were more likely to say that they have coworkers who are bicycling. But it was this: they don't have time to bike places instead of driving was a big barrier. And that gets at other sort of social issues of still in most households, if with kids, a male-female couple, the woman is more likely to be the one taking the kids taking them traveling, or also taking now more and more the older adult parents. And so those serve passenger trips, women are more likely to be doing that, and doing it on a bicycle is either impossible or definitely very challenging. And then again, looking at our data from the tweens and teens, we started seeing some of these differences here. And the one I'll point out in particular, so these were reasons these kids aged 11 to 16 were not bicycling. And this one is no one to bike with. And there was a significant difference between our girls and boys there. Girls were far more likely to say that that's not why I'm cycling. Now, one thing I don't know about this is if it's because their parents don't want them biking alone, and so they need someone to bike with them, or if they really want it to be a social thing. And so that's certainly an area for some more research. But also it takes too long. We also started seeing a gender difference in these 11 to 16-year-old girls. So these patterns are starting fairly early. So what's the solution to this? Again, it's an area there hasn't been a lot of research on, but my hypothesis would be if we just get more people cycling, a lot of these sort of more social issues will drop away as it becomes more of the norm. I'm guessing, how many of you heard about the study out of Australia characterizing that people characterize bicyclists like cockroaches? Did you, a couple of you? Okay, Google it. Yeah, that idea, there's a lot of research out there that people who do not bicycle think of cyclists as sort of other, as very, you know, they don't relate to them. And this study sort of showed that they actually, on a scale, related closer to cockroaches than, I don't know what was on the other end of the scale, I don't remember. But, okay, getting back to this model, I'm going to go up to the physical environment. And again, barriers to bicycling. One that we've asked about was that places are too far away. And you can see across the board, this is a barrier for about half of the adults that we surveyed, the reason that they couldn't bike places. There's a bit of a gender differences, but for the most part, this is a problem for everyone. This is not an easy problem to fix. The solution really is redesigning our cities and land use planning. And I've highlighted here, this is the Portland region's land use plan, which is really, we have an urban growth boundary, we are densifying along certain corridors around transit. Having your destinations closer together inherently is going to make it easier to bicycle and make those distances shorter. Also things you can do with street connectivity that will make distances shorter. Next set of physical barriers. These were reasons, a couple reasons related to sort of the transportation infrastructure. Having too few bike lanes or trails, and I do not feel safe because of traffic. And that do not feel safe because of traffic. Overall, 41% said that that was a barrier and a reason that they were not cycling. And particular, this is the gender one. So this 48% or 49% is women compared to only 34% of men that were citing that as a barrier. You see a little bit of income differences, but again, it's the gender difference is really what stands out. So how do we approach that? I think a lot of you in the room, and I certainly saw evidence that the city of Edmonton is taking this approach in their planning and in the infrastructure being built, is this idea of an all ages, all abilities network, or an 8 to 80 is another term being used. And at least one of these, this was from yesterday downtown when I was in downtown Edmonton, and this is actually in Vancouver, British Columbia. So all sort of comfortable bike facilities. So when we've asked adults in a survey, how comfortable would you feel, and then we describe different environments, because this is over the phone or on an internet survey. These are their comfort levels, and I'm stressing here again the gender differences. On the left, starting with an arterial road, and it was described as like 35 to 40 miles per hour. I forgot to translate that to kilometers. And you can see both men and women do not feel comfortable. And this is the percent that feel very comfortable. Because I would say people need to feel very comfortable if they're going to do something. And most people, at least. This next one is if you added just a striped bike lane, which is, I think I see one like that just out this window here, just the white stripe on the side of the road. It definitely increases comfort level for men a bit, but not for women. And I will just tell you right now that the research that we've done in Portland and a few other places, the striped bike lanes don't really do much to actually get people to start cycling. Okay, people will use them if they're convenient, but it's not going to start getting you a lot of cyclists. Then we have a protected bike lane with a physical barrier, so similar to the ones that you've built here downtown, and you see comfort levels going up significantly. Still see a gender gap, but a big difference. And then the next thing we asked about was just a quiet residential street with like 20 to 25 mile an hour traffic, just a regular street and with very little motor vehicle traffic, and you see comfort levels going up quite a bit. Then we described a bike boulevard. How many of you have heard the term bike boulevard? Sometimes the neighborhood greenway, some places are using. I'm going to show you a picture in a little while. But we described it as a quiet residential street that would have traffic calming features that would slow down motor vehicle traffic and reduce the volume of motor vehicle traffic. So we sort of described it to people over the phone. And that's where you see women's comfort levels going up a bit. And then this is a totally separate path or trail, and that's where people generally feel most comfortable. Researchers at the University of British Columbia did some similar research in Vancouver with almost identical results. People are feeling most comfortable on these separated pathways. Then these, well, both of these are sort of separate paths, a little more separation in this case. Actually, sorry, all three of these are types of paths. Down here is where you're getting into more of the cycle track or protected bike lane, and this is the bike boulevard concept. And just so we're all on the same page, because I'm a huge fan of bike boulevards, the idea is to take a low traffic residential street, and when I say low traffic, in Portland at least the policy, they're focusing on streets that only have maybe 1,000 cars a day. So these are like your lowest traffic streets. We usually implement these in a neighborhood where you have a fine-grained grid street network, so traffic can easily use other streets. Use a variety of traffic calming features, speed humps, some diverters. So here's a case where cars cannot keep going, but bikes can, and pedestrians. Sometimes traffic circles. Also, when a bike boulevard is crossing a major road, might put in either a traffic signal or a rapid flash beacon or something to help the bicyclists and pedestrians cross that street. And usually putting stop signs on the cross traffic so bicyclists and other road users do not have to stop along the bike boulevards. The idea behind a bike boulevard is when you ride on one on a bicycle, you rarely see a motor vehicle, and if you do, they're going the same speed as you are, and you just ride down the middle of it. This is my bike route from home to campus. At least half of it is on a route like this, and you don't have to think. You don't have to be stressed at all. Highly big fan of these, and I'm particularly a big fan. I mean, my personal experience, I know that I love riding on one, and in the research that we did in Portland, where we had people carry around GPS units with them for several days, what we found is that the bike boulevards essentially eliminated the gender gap altogether. So if a woman had a bike boulevard along their entire route that they could take on a bike trip, they were just as likely as a man to ride a bike for that trip. And so now I will have to say, in the when we did this study in Portland, we did not have very many at all protected bike lanes like the ones downtown, and we do have some now in Portland. So I don't have direct data on that, but I do have direct data that bike boulevards can be a big success in terms of the gender gap. We have done research in 5 US cities on protected bike lanes. We did this a few years ago in Portland, Chicago, Austin, Washington, D.C., and San Francisco. And these are just showing the increases, 1-year increases in bicycle, the numbers of people on bikes counted on these different facilities. Now, within the first year, a lot of this traffic, bike traffic, was diverted from other routes, but anywhere from 5 to 15 or a little bit more % of that were people who said, I would not have bicycled on this trip if this lane had not been here. And I think that over time that would increase. We also intercepted the cyclists and asked them, because of the, whatever the name of the bike lane was, separated bikeway, how often I ride a bicycle overall has, and we were looking, has it increased? And what we found when we look at the gender differences is that in most of our cities, there was a big difference. Women were far more likely to say that because of the separated bikeway, I'm riding more often now. And the 2 bars on the far right is for all 5 cities combined. And in some places like Austin, Texas, we saw really big increases in that. So I do think that both those types of facilities are particularly effective at attracting women to bicycle, and I also suspect it's going to be helpful for kids cycling and parents feeling comfortable about their kids cycling. Okay, so going up to our last part of the socio-ecological model is that policy context. Now, obviously, many of the things that I just showed you in terms of bicycle infrastructure, you need policy. You need a bicycle plan, you need funding, you need political support, so policy is important in getting that physical environmental change. But there's some additional things to think about as well. It's not just about infrastructure, though I do believe infrastructure is really important. So this sort of word cloud is from some research that we did. The research was focused on how to increase equity in bike sharing systems. We focused this work in New York, Chicago, and Philadelphia. We did surveys in neighborhoods that were predominantly lower income and people of color. And there were neighborhoods that did have relatively new bike share stations. And so there was an effort to increase who was riding bike share. So we did surveys of people who lived in these neighborhoods. And what this graphic is showing is the just barriers to bicycling broadly. Not just bike share, but why, is this a barrier for you bicycling? And what we've done here is this group on the left are higher income people of color. This is lower income people of color, lower income white, and higher income white. So those were the 4 demographic groups that we looked at. And the size of the words is proportional to the % who stated that this is a big barrier for bicycling. Now, the first thing to point out is dangerous traffic is a barrier for everyone. Okay, so everyone wants to feel safer, equally safer, and it's a big barrier for most people in general. The other thing to point out here is that for higher income white people, you can see most of these words are a lot smaller. Far fewer barriers for the higher income white people that we surveyed in these neighborhoods than for, in particular, this group here, the lower income people of color. And a few things on the policy side, well, let me go back. So you also see things like destinations too far is a barrier. So a lot of things that I've already covered. But there's a few things here that get at another dimension of policy. No safe bike storage at my destination. For people of color of both high and low income, that was a pretty big barrier. Not a much smaller barrier for higher income white respondents. And this no safe bike storage at home for lower income people of color. Okay, so living in smaller apartments, usually there's not going to be room for bike, there's no bike storage. So there's definitely policies, zoning, building policies, etc., to provide safe bike storage in new housing, and certainly ways that you can be doing retrofit as well. And then another one I will point out here, it's not a huge, it's, you know, as a relative to some of these other barriers, it's not as big, but could get harassed. And then much smaller, but it does show up somewhere up here, is the idea that I might get targeted by the police if I'm out riding a bike. And that was a bigger, it wasn't a big concern, somewhere in the 10% range, but it was definitely a bigger barrier for the lower income people of color that we surveyed in these cities compared to the other groups. We've also done some qualitative research that immigrants feel concerned. That may be, I definitely know it's a US problem, of fear of our immigration policies. And then the other thing is this idea, and this is from, I'm going back to our national data, I do not feel safe because of crime, that this is a reason that I don't bike. And so this is something that actually is a bigger barrier or a problem for younger adults that we surveyed. Definitely a bigger issue for women. So for women, it's not just safety from traffic, but also safety from crime and harassment. And it's definitely an issue for lower income adults. And I don't have a slide that has the solution for this because I'm not an expert in criminology, and we could get into a huge discussion about how to improve crime. But again, this is multi-layered, multi-dimensions to the policy approach to increasing cycling. And then the other thing that I want to actually make my last point on this sort of the larger policy is that when we're doing planning and policy making, that we need to have inclusive public processes and planning. There's been over the past several years a lot of debate and focus in the sort of the bicycle advocacy community that the leaders in that community need to be more diverse and representing more diverse groups, and not just be, quite frankly, a lot of middle-aged white men who are traditionally who is cycling the most and who is promoting more cycling, which is great, but we need more voices at the table. We need to take different approaches, and so that's really important as we move forward in creating good cycling communities. And with that, I'm going to end it, and we have plenty of time for some questions. And I have my contact information up there as well.